and I'm a primary care physician for the last 27 years. Recently, we posted a video on cholesterol, and since then, we have gotten a lot of questions about cholesterol. And I thought that we will do this live session and we will do kind of interactive question and answer. And we have collected about 15 questions which had been asked by our patients over and over. And the goal in this video is to make you understand what cholesterol is, how body handles it, and what are the nuances and where do we stand in cholesterol care and what are the lifestyle changes we could make and what are the things we could do if we don't want to take medications. Cholesterol is not the villain what you think. Cholesterol is pretty much needed for everything which happens in the body. Life is not possible without cholesterol. Cholesterol is like a waxy fat like structure which is primarily made by your liver, and some of it is being absorbed from our nutrition or what we eat. The confusion lies that we use the word is a waxy fat like, and we tend to confuse it or use it synonymously about the fats or triglycerides which we absorb after we eat any kind of a fatty meal or fatty diet. Cholesterol and fat in our blood, there are two separate things. Fats are not soluble in water, and your blood is water. Body, in its wisdom, combines this fatty acids and also the cholesterol with another protein we class, which is lipoprotein. And this combination of lipoprotein acts as a vehicle, which has vehicle is the lipoprotein and it has two kind of cargo. One is cholesterol and second is fats. Why do we need cholesterol? As I said, life is not possible without cholesterol. Every cell membrane in your body is made up of cholesterol. Important hormones like estrogen, progesterone, testosterone, and stress hormone like cortisol are made from cholesterol. Third is vitamin D, which is required for your bone health, is made from cholesterol. And fourth major thing is, in addition to multiple of them, is your digestion of food is not possible. When you eat, the fat which gets into your gut, that needs to be broken down and emulsified. For that, you need bile salt, which are made from cholesterol. Cholesterol does very important things. The confusion lies that the same lipoprotein which carries your cholesterol also carries fat. So this lipoprotein vehicle, which we will call it in, has two cargoes, cholesterol and fats. Just imagine your body as a city which has multiple highways and then some highways breaking into major roads and smaller roads and street roads. And ultimately, around each street roads, there are houses on both sides, and in between the houses, there are spaces. And each house usually has a some space before you enter the house, which is the front of the house. So if we take this concept, the cells space in between and some space in front of the house, then you will kind of imagine how cholesterol flows. In the imaginary vehicle, which we have just now talked about, the lipoprotein, which is carrying cholesterol, and you have fats, that is the vehicle which is going through these highways. When liver produces this vehicle is full of triglycerides and full of cholesterol. As this vehicle travels through your circulation, our body picks up the triglycerides wherever it needs to be picked up. So the initial vehicle or truck which bird liver creates, we call VLDL. It's called very low density lipoprotein that has both very high content of cholesterol and LDL cholesterol and fats. When this vehicle loses a little bit of cargo of your fats, it gets converted into intermediate product, which is another kind of vehicle in imaginary analogy which we are using. It's called IDL. When it loses a little bit more of fats, then it's converted into the real villain of our cholesterol story, which is called LDL cholesterol. So LDL cholesterol ultimately, which we measure when we do the blood work, that is having this major cholesterol problem. So number of vehicles which liver is producing and how much cholesterol and fat is carrying from journey from VLDL to IDL to LDL cholesterol depends on lot of physiological factors. Recapitulating so far, cholesterol is essential for life. We talked about fats and we talked about the our vehicle analogy or the truck analogy, how it's being taken on the highways. What happens is if there are too many vehicles on the roads, the smaller streets start getting clogged up. And then these vehicles, when they crash, metaphorically the LDL cholesterol that enters in the front of the house. They're trying to enter the inner lining of your blood vessels and in between those metaphorical houses, meaning in between the endothelial cells. When they do get there, they dump their cargo and then they get oxidized. That chemical reaction attracts a lot of inflammatory cells, and those inflammatory cells, they are trying to clean up this mess or debris, but in this process nature works against us. So what will happens is those inflammatory cells secrete chemicals we call cytokines. They go to rest of the body and recruit more of inflammatory cells, and the bigger inflammatory cells. Initially is the white blood cells which come in, and later on the bigger cells we call macrophages. And these macrophages eat up the debris and swell up, and they are called foam cells. And they produce more chemicals which attracts more of these macrophages. And then there is accumulation or debris is getting collected. And that's how the plaque formation starts. Nature has designed liver to produce another kind of vehicle, which we could use the analogy of towing truck. That is also part of the cholesterol, but it is a different kind of lipoprotein which liver creates. This lipoprotein, what it does, it picks up the debris from periphery and bring it back. It's a reverse transfer. The VLDL to IDL to LDL is the one which is taking away from our liver to different organs, cells, where it could be used for its physiological needs. But the HDL cholesterol or the other vehicle, the towing trucks, they are the one which bring the cholesterol back to our liver. So there is, in a normal physiological conditions, there is beautiful symphony between what is being delivered and what is not used up, bring it back to the liver to recycle it, reuse it, destroy it, convert it into bile salts, or whatever the physiological needs is. Now we will start where the whole process falls apart. In this analogy, there are two things which are important. Number one, how many vehicles are on the streets, meaning how many number of particles which are being created by the liver and put it into circulation, and how much accidents or debris they are going to display in the periphery. And also, it also depends on number, the amount of cargo which is loaded on this vehicles. And third component is this towing trucks or the HDL cholesterol, how many of them are being in the circulation. This total cargo, number of vehicles, and also the HDL cholesterol. These three components will determine how much disease you will develop in future. Physiologically, how do we override our cholesterol and how we disrupt this harmony which we have between different parts of the cholesterol system? If you eat highly processed foods, that leads to increased production of insulin. Insulin goes to your liver and it tells that liver factory that you do not need to use this cholesterol for different organ functions. They need to be stored, and body start producing more and more of this bad vehicles, and lot of vehicles are put it into circulation. And technically those particles are small. They're because the factory is working over capacity under the effect of insulin. Those particles which are created, they are small, and they are going all over the body, and number increases, they are clogging up our arteries. Also, insulin does is the good cholesterol or the towing trucks, it decreases the function of them and the number of them. So for that's how your processed foods affect your cholesterol. Third thing insulin does is it converts everything which is there, and it wants the body to store as fat. So you gain weight, your amount of cargo which is being loaded on this trucks increases. So, and the number increases, and your HDL cholesterol decreases, and your triglycerides increase. So everything gets messed up. When we start eating processed food, our total cholesterol increases, our triglycerides increase, our LDL cholesterol number increases, and the amount of cholesterol and fat which is loaded onto these vehicles or lipoprotein increases, and our HDL goes down. Second scenario is the fats. Anything processed we eat or anything fried we eat, and if the vendor is using that oil repeatedly or all the packaged ones, they use trans fats. These trans fats are chemically designed in a way that it gives food crispiness. They hijack our taste buds, and in the body, they are not recognized as normal fats. Our body is designed to understand, or our body knows what is saturated fat is, and our body knows what is unsaturated fat is. But once these trans fats, which will get into the body recognizes them as foreign, and they provoke a lot of immune reaction, and the chemical changes which are described when the inflammatory cells comes in, those chemical changes happen. And also under the effect of these trans fats, our liver start producing a lot of again bad cholesterol or LDL cholesterol, and it loads a lot more on these particles, and the number increase, and it also decreases your good cholesterol significantly. Lack of exercise. Remember, cholesterol is needed for cell repair, cell growth. Why kids never have high cholesterol? Because they are growing, they are full of life, their cells are growing, multiplying. But once we become old, 20 and 20-year older than that, that is the time our body is not in a growth mode. So without exercise, there is no breaking of the cells, there is nothing else is happening, and that leads to accumulation of cholesterol in our body. Lack of sleep. If we don't sleep, we produce a hormone granule. You might have noted the days you don't sleep, you become very hungry. That hormone makes us eat. That's number one, we overeat. Second is it goes to the liver and tells it to produce more LDL cholesterol or bad cholesterol. So sleep is very, very important. We had a lot of questions regarding this thing is how much, why my sleep and the cholesterol is linked. Next, most important is management of your stress. When you are anxious or depressed, you will have high levels of cortisol, and that level, high levels of cortisol will increase your insulin levels. That will do exactly what processed food I section I explained it. The irony is now, if we don't eat right, we don't exercise, we don't sleep, and we don't manage our stress, we are bound to be fat and we will have bad cholesterol profile where our LDL cholesterol is very high and number of particles of these delivery trucks are very high and our good cholesterol or the towing trucks will go down. In the United States, about 10% of kids above the age of 20 have a very high unfavorable cholesterol at the age of 20. That's why the kids who passed on in wars, when they checked their arteries in 20s, they had fatty streaks. Other irony is there is a lot of emotions and politics behind cholesterol lowering medications. People do not want to accept cholesterol lowering medication due to multiple different whole host of problems. In the United States, the average cholesterol, if we take the whole US as a one bucket, on an average, our total cholesterol is 187 milliliter per deciliter, which is almost 50 points more than the rest of the world. In the United States, there are about 71 million people who should be on cholesterol lowering medications. And I will explain these medications in a minute because that is also a topic which came over and over. 71 million people, only one third of the people are on appropriate cholesterol lowering medications. So it is a very big problem, bigger than we pay attention or give credence. Problem is high cholesterol does not give you any symptom. I wish there was a pain if you have high cholesterol. If you have triglyceride component of the cholesterol, which is very high, sometimes you will get pancreatic problems, but those are very few cases. By and large, high cholesterol has no symptom. The first symptom will be either heart attack, stroke, or you have a PAD, you can't walk, or mesenteric ischemia, or where you lose part of your gut. There is no symptom. We need to be screening ourselves and we must go for our routine physicals and we must know our numbers. In this section, I'm going to go over how to interpret your cholesterol. Whenever you have a cholesterol profile done, you get first number is always total cholesterol. That is combines everything which is floating in the form of cholesterol, which is loaded on different particle, whether liver producing VLDL, ILDL, and LDL cholesterol. That is, and plus your good cholesterol. In total cholesterol, everything is included. That's why sometimes having a high total cholesterol may not be a bad thing. If you have somebody whose good cholesterol is very high, their total cholesterol will be high too. But that is a good thing. But in the same different analogy, if your good cholesterol is very low and your total cholesterol is very high, that is a problem. This means your bad cholesterol is very, very high. Further, second test, now let's know the numbers. We want this number to be as low as possible, but definitely where we want to keep it is around 100, and you will not find yourself. But Irrespective, I'm not going to go through the guidelines because those needs to be individualized for each patient. But I will give you a number 240. If your total cholesterol is more than 240, you have a cholesterol problem. That's one screening tip. Second component, when you look at the cholesterol profile, you will see triglycerides. Remember, triglycerides depend on, this is the fat which is loaded onto those LDL particles, and those are the one which are produced by the liver. Or either you're consuming this fat and which is loading onto chylomicrons, and eventually this one is. What I want you to know is your triglyceride give insight into what is going on in your dietary component part of it is, or the insulin part of it is. If your triglycerides are very high, you definitely have a possibility of having insulin resistance. And your blood sugar may be normal now, but that is a very clear indication that you will develop type 2 diabetes mellitus. And we want to keep it around 100. Third component is LDL cholesterol. That is the one which we all know, or what we always talk about. LDL cholesterol is the one which is most abundant. This is the vehicles or the delivery trucks which are taking cholesterol, what is either made by the liver or will result from your gut to different part of the bodies to be used. And once that is high, it clogs up the arteries, which I have explained you the mechanism. And we definitely want to keep it as low as possible. Goal is the LDL cholesterol should always be less than 100. Ideally in 50s and 70s, but definitely never more than 100, irrespective of what you have. If your bad cholesterol is more than 100, we have a problem, and we will take up in a minute. Fourth component is your HDL cholesterol or the good cholesterol. We have two problems here. We want it to be as high as possible. There are three things actually, which are very detrimental to HDL cholesterol. Number one, smoking. Smoking, if you smoke, your good cholesterol bound to be in toilet. It will not be high because smoking destroys or leads to problem with the lipoprotein, which is the one which is carried. So what it does, it makes your towing trucks defective. So that's how smoking. If you look at a smoker by and large have a lower appetite. They are skinny, and they have a total cholesterol in the normal range. Their bad cholesterol be just shade high, but their good cholesterol is very low. So the ratio of your HDL, total cholesterol, triglyceride, bad cholesterol is unfavorable. So smoking is, that is how, by affecting that lipoprotein which is required for this towing truck to be effective and running and cleaning our cholesterol garbage, that is goes down. Then, as I told you, insulin suppresses the number of HDL particles, and so as our uh, trans fats. Now, the other part comes in is the ratio between your total cholesterol to HDL, because there are two arms. One is everything on one side and HDL cholesterol on the one side, because HDL is your good side, the other side is bad side. On the bad side, there are multiple actors: total cholesterol, LDL cholesterol, VLDL cholesterol, and then your triglycerides. Other fascinating fact you must know is, once we do the labs, in your labs, we actually do not measure your LDL cholesterol. It's a calculated number. It's a guesstimation based on your triglycerides and total cholesterol. And there's a formula which you could Google it. So when you are testing your cholesterol, the bad cholesterol on which whole treatment profiles are built, all the guidelines are built, we do not actually measure LDL particles. So now there are two tests which are available, which gives a really the real glimpse into your bad side of the cholesterol equation. That is ApoB. There is a test which that lipoprotein which get attached to initially to VLDL, ILD, and LDL. We could measure in the lab. It's a very cheap test. Ask your doctor to order ApoB level, and that will give you the equation about the bad side. And then your HDL cholesterol has a lipoprotein, which is ApoA1. So these tests can be done very quickly, and these tests are very cheap. And start asking your physicians to get those questions done. I hope so far I have explained you what cholesterol is, why it's so important physiologically, and how we mess up our cholesterol physiologically with the diet, processed food, trans fats, and then insulin, and then lack of sleep, stress, and smoking. Next question was, what are the different types of cholesterol? That's what I've been explaining you is we start with cholesterol production. I think this concept needs to be explained. Your cholesterol, which is floating in your blood, comes from two sources. 80% of the cholesterol is formed by the liver, and 20% only comes, if at all, from the dietary source. How much cholesterol you consume and how much is going to be absorbed in the body depends on what is the physiological needs are. If you eat unprocessed food, do not smoke, you sleep, you manage your stress, body's innate wisdom will control how much they have to absorb from the gut when you eat and how much liver has to produce. Based on physiological need, our body's internal mechanism can control it. But once we start overriding these mechanisms, that is the time we have a problem. We used to think that the dietary cholesterol is very important, that how much what we eating, whether we eating saturated fat, unsaturated fats, or we're eating trans fat, that have a lot to do with what's going on regarding cholesterol. What we are finding it out is we don't believe currently is that the dietary sources other than trans fats that they play much role in how much total cholesterol is which is being circulated in the body. So when you talk about the cholesterol, 80% coming from the liver, 20% from your diet. We do not know how much your dietary like things which we're eating. There was a lot of discussion whether we should eat eggs or we shouldn't eat eggs. As we stand and we are talking today, we don't have any data to prove whether this cholesterol affects it. Next question is why high cholesterol is so dangerous. As I explained you in the analogy, how we make the plaques, these LDL cholesterols, when they are too much in the body and they're loaded on a lot of lipoproteins, once they get oxidized, they make a plaque. And that plaque formation leads to narrowing of the lumen of the artery. Now, when the arteries are getting plaque formation, arteries getting narrowed. If you change your lifestyle, your HDL cholesterol goes up, and you correct all the things, and your liver start producing less of this LDL cholesterol, your plaque starts shrinking. This plaque formation is not a fixed process, it's a dynamic process. This plaque formation can increase if you continue to do the wrong thing, and if you do the right thing, the plaque can shrink. That is the most critical message which I have for everybody is the plaque is dynamic. Further, if this plaque keep on growing, your body is going to try to control this plaque formation significantly. Uh, what happens is first initially the body will try to cordon off this plaque and make a scar tissue around it. We call and then calcium will come in and we will make this plaque harder and calcified. What nature is trying to do is trying to put a boundary wall regarding garbage which we have delivered, and there is a debris there, and nature is trying to restrict it.